Okay, the question of the hour, does fat last? Everyone says, no, it's going to go away. It's a waste of time and effort. I tried it, it doesn't work. And it really does if you do it right. So how do I understand this? I was studying for my board in hair restoration surgery, and I started to think, oh my goodness, why am I seeing my fat grafts actually get better with time? They get better with time. They don't go down with time. Now, why is that? Because here's the reason why. When you put a hair graft into the head, it doesn't grow for about 6 months, and it gradually improves over a period of 18 months because of neovascularization, new blood supply. So if that's the case, what am I seeing with my fat results? Well, this is what I'm seeing. What I initially see is too much swelling for the first 1 or 2 weeks. Then it looks great at a month because all the swelling is knocked, all the wrinkles out, they look great. And then at 3 months, I have patients come back to me and say, doctor, it doesn't look as good as I thought. Why is this? Because the fat cells have shrunk a little bit. But then magically, I wait. I don't do touch-ups, I don't touch them, and I wait. And it gets better and better and better with time, up to about 18 months, and then there's a little bit of aging. So let's follow this process photographically. Here's a lady, 49 years old. This is a week out. You can see she looks younger, even though she looks very stretched and weird and somewhat bruised. We get into a month. It still looks maybe a little bit too full, but it's very stretched out, looks very young. We get into the 3-month range, and it's starting to dip a little bit, and this one is not a bad dip. You look at her and say, maybe she looks better. But as we get into the 6-month range, it may have come down just a little bit, and you say, well, that's not great, but it's not bad. Okay? And then we just wait. We just let it sit, don't touch it, do not do anything. At 11 months, it's starting to look better again. And then we go up to about 15 months, and it really looks very youthful and soft. And so that's without a touch-up, that's without gaining weight or anything. I want to talk a little bit about your language, which is thinking about bone versus soft tissue. Do we need to do implants or bony reconstruction for rejuvenation? And I'm going to argue, for the sake of rejuvenation, most likely not. Why? Okay, so we go back to the previous illustration, which is we lose fat from birth to death. So if that's the case, how do I see this? Well, we lose more soft tissue than hard tissue. That's if you keep your dentition good. You know, this is not talking about 19th century when people lost all their midfacial bone structure. You do lose bone. There's no question as you age, you lose bony volume. You can see it on CAT scans. But I'm talking about we lose more soft tissue to hard tissue. So if we replace hard tissue, is that the right answer? And I'm going to challenge you, may not. So we lose more soft tissue to hard tissue. So if we put an implant in there, we actually, in my opinion, create more of an exposed look to the bone. So we need to do something different. What is it? So we go back to aging and we lose more soft tissue than hard tissue. Then what do? We make it look youthful again. We increase the differential between soft tissue to hard tissue. We cover exposed bone, and I think you look more youthful. Again, this is exposure of bone as we get older. And if you go back and take your photographs every 5 years and follow it, you'll see that the principal reason for aging is volume loss of soft tissue. Okay. Another important point that I didn't talk too much about today because of limited time is understanding facial transitions. We have more and more transitions: tear trough, cheek exposure, buccal hollow, anterior chin exposure. All these things get worse and worse as we get older. So if we put implants to push this out or push this out, we tend to accentuate facial transitions. Fat grafting is meant to soften transitions and blend it in. So is a fat transfer then the right answer for everyone? The answer is no. There are certain issues that are a risk. So you need to know this before you start. My feeling with fat grafting is it's not particularly safe in very young people because of metabolic changes. Remember, if we go back to the idea that fat is actually a live graft, just like a hair graft, if you're doing it in a 15-year-old, my fear is how is it going to age in someone when they're 40? Because it truly has blood supply. I have seen my patients gain 30 pounds. They don't look good with fat. They look better if they maintain their weight. So that's one of the big things, is weight fluctuations and metabolic changes. So I believe implants look much better in younger people with a soft tissue envelope to cover it. And I believe fat looks much better in older people and much safer in older people that, again, maybe late 30s and beyond, that the issue is soft tissue. It is not bone. I hope that makes sense. So it's the sort of an inverse ratio. So if you remember one thing, like replaces like. If they have, for example, a hypogenia or microgenia, that's a chin implant. Or you can do some kind of Lefort or some kind of sliding genoplasty to correct it, depending on what your modality is. But if there is a bony loss, you need to bring this forward. The book that I wrote on fat transfer details sort of the technique and the philosophy. And if there's any questions, I would be happy to entertain them at the end of this talk, and also, or at the end of this session, and that's my email address. Thank you for your attention.